Amanda, we will be recording the meeting as well.
Okay.
So we are live. Yes. Amazing. Hello, everyone. How has the week been? I mean, it's been like 2 weeks that we came online, and every alternate week we come on Endo Crusaders to do a session on endometriosis. So women with endometriosis, as a research indicates, that many women with endometriosis have hormonal imbalances, mainly estrogen dominance. I would not say that every patient has it, but a lot of them have estrogen dominance. And balancing the hormones is imperative when it comes to managing endometriosis. And the other thing is adenomyosis that occurs when the tissue that normally lines the uterus grows into the muscular wall of the uterus. And the displaced tissue continues to act normally, thickening, breaking down, and bleeding during each menstrual cycle. So it is also called as the endometriosis of uterus, not particularly endometriosis, but it is called as, freely called as. And the prevalence of endometriosis in adenomyosis was 80.6%. And the prevalence of adenomyosis in endometriosis was 91.1%. That is like a big number. So we thought that these two topics are certainly something which we need to talk about. And so we are here today. I'm Dr. Shilpa, and I have with me Dr. Vimi, who is an endometriosis excision specialist, and Amanda, who is a women health dietitian. Welcome, both of you.
Hi.
Hi, Vimi.
Oh, you're muted.
Vimi, you're muted, yes.
Hi, Shilpa. Hi, Amanda.
Hi.
It's so awesome doing a session every alternate week, creating awareness about this particular condition, which is hardly spoken about. So, Amanda, let's begin this with you. So tell us a little about your journey and how did you get into nutrition?
So I was always interested in athletics and food. I grew up making everything from scratch with my mom. So I always had an interest as a young age, and I was originally going to school for nursing. And then I decided, I think I want to make food like my career. So I decided to apply for a dietetics program. And at the time, I was very gung-ho on like sports nutrition. I was an athlete. I was like, this is what I'm going to focus on. And then when I was about 20, I was dealing with like depression, anxiety, and I thought that it could have been from the birth control pill. So I talked to my doctor. They're like, you can stop taking it if you want. So I stopped it. And then everything just turned upside down in my life.
Why were you on birth control pills?
I was on it for acne.
Okay.
Yeah. So not for the reason you're supposed to be using it, but acne, I had painful periods always. I got my period at a very young age. I think I was pretty much estrogen dominant my whole life. And that just exacerbated those cramps. But I came off, decided I didn't want to take it anymore. It wasn't really helping my skin that much. And then I didn't get my period for almost a year, and my hair was falling out. My acne came back like 10 times worse, and no one could help me. My doctor was like, just go back on the pill, you're fine. And of course, I'm concerned that I have some like deeper underlying health issue. And so I saw 3 different doctors. I saw a naturopath, and everyone kind of had the same response. It was just like Band-Aid approaches, like giving me medication or supplements that weren't really helping. And so I decided, I'm like, I have to just figure this out for myself. And I switched my focus from sports nutrition to women's health.
That's amazing. That's like a lovely thing that you did. I think you're helping a lot of people out there. So endometriosis causes hormonal imbalance. That is something which we know. But how bad is the hormonal imbalance in endometriosis?
I tend to see it's interesting. So you won't always see it on lab work. At least I don't always see it with clients. That I don't always see high estrogen levels, but I often will see very low progesterone. And something that happens a lot with endometriosis is that estrogen tends to be a little bit more sensitive, and you can actually become progesterone resistant. So your progesterone receptors don't quite work as well. And so even if you don't necessarily have very high estrogen, if you don't have healthy levels of progesterone, you can still be dealing with that estrogen dominance and all those kind of symptoms that go along with it.
Absolutely makes sense what you're saying. Like we just said that estrogen dominance just does not mean that excess of estrogen. So, what are the symptoms of estrogen dominance that you generally get to see?
The biggest ones that I often see are weight gain, like especially like dealing with that around your hips, thighs, midsection, and having it almost like unexplained, like you might not have really changed anything with the way that you're eating or exercising, but it just kind of keeps coming on. Fibroids are a big one. Endometriosis, that is a side effect, because if you have the estrogen dominance, it can impact that. Bloating and digestive issues. Estrogen is an interesting one for our digestive system. We need enough. I feel like this is kind of how it is in the whole body. It's like Goldilocks. Like you don't want too much, but you don't want too little, because you can be symptomatic either way. Like you want that perfect amount of estrogen to support the different systems. I also tend to see a lot of thyroid issues. And that's because when we make a lot of a hormone like estrogen, we tend to make this binding protein that will bind to other hormones, including thyroid hormone. So then all of a sudden it appears that you have this sluggish thyroid, which a lot of my clients with endo are also diagnosed with hypothyroidism. And it's really more of a result of the estrogen than your actual thyroid not working itself. And then headaches and migraines. I feel like that's a pretty common one. And gut issues. I see gut issues the most with my endometriosis clients. They typically have lots of bloating, constipation, really sluggish digestion, reflux, like pretty symptomatic digestive wise.
Okay. What you're saying is something which probably I can relate to so much. I remember, when I used to go to the gym and my dietitian used to, and that's like ages back, even before I was diagnosed with endometriosis. I remember my dietitian making a diet chart and telling me that follow this every day to the T. And I used to do that. And the next day she used to check my weight, and my weight used to fluctuate by 2 kilos here and there. And she used to be like, persistent, you must have eaten something for sure. And I kept thinking, I was like, I haven't done anything, I've just eaten the same thing every day. So I can join the dots now, with the bloating and the migraines and everything. Completely with you on that. So Vimy, adenomyosis, another big problem. What exactly is adenomyosis?
Shilpa, before I go to adenomyosis, I would just like to mention here that we are talking about hormones, but it has to be differentiated from PCOS also, because many people confuse this with PCOS. So endometriosis is different. The hormonal imbalance we are talking about is different as compared to PCOS. If we check the blood levels, they may be normal in endometriosis, but not in PCOS. So this is very important. True. And this endometriotic tissue produces their own hormones. That's the reason they don't respond to hormonal therapy. So this tissue is different from the uterine lining. So the mechanism of action of endometriosis is also absolutely different. So we are talking about hormones, hormonal imbalance, but this is not something which we can detect in blood and diagnose endometriosis. It is just so that they don't get confused. That's why I'm just clarifying.
Absolutely. That's
PCOS and endometriosis is so much confused nowadays. Girls come to me and then they tell me that I have multiple cysts in the ovaries and I may have endometriosis. But endometriosis and PCOS are two different things. Hormones do play a part in endometriosis as well as PCOS. Now coming to our topic, adenomyosis, which is least talked about. And most of the endometriosis women may have adenomyosis as well. It may occur alone. It may be associated with endometriosis. Adenomyosis is basically similar to endometriosis, but it happens in the uterus. The lining of the uterus, the uterine glands and the stroma may be found in the muscle layer of the uterus, where they break down, they proliferate, and they're surrounded by the hypertrophied and hyperplastic muscle layers. This is called as adenomyosis, or sometimes we also refer to as endometriosis of uterus. Endometriosis, as per the definition, it is outside the uterus. Anywhere in the body it can happen. The tissue similar to the lining of uterus, when it is found outside the uterus where it does not belong, is called as endometriosis. When the same phenomena happens in the uterus, that is called as adenomyosis. Now, the difficulty happens is when we treat these patients, those who have both endometriosis and adenomyosis, because this disease is in the uterus. The disease outside the uterus can completely be excised and removed, but in the uterus, when it comes, we have to be very judicial how we are going to treat it.
True. Absolutely. So when patients come to you with whom you detect with adenomyosis, what's the symptoms that they show?
Most of these patients, if they have only adenomyosis, I'll say what are the symptoms. They have painful periods most of the time. They present with heavy bleeding, menorrhagia. They may have continuous pelvic pain. Sometimes they may have a uterus so big as the size of a watermelon. They may feel the lump in the abdomen. Sometimes concomitant fibroids may be found with adenomyosis that also enlarges the uterus. Another most important symptom which patients present to us is the frequency of urination and incomplete emptying of bowels. Because of the big size of the uterus, it puts pressure on the bladder and they feel like passing urine frequently. And sometimes they may be constipated and can't pass urine. If it is found with endometriosis, then they may have combined symptoms of painful periods, dyspareunia, dyschezia, pelvic pain. Sometimes they may have fatigue, depression, mood changes. Fatigue, depression, and mood changes common to both the disorders. And also they present to us with severe anemia because they bleed a lot during periods. It's more than average and it is associated with pain. So dysmenorrhea and menorrhagia are the most common symptom of adenomyosis. These are the two symptoms which are like indicative of adenomyosis on a clinical history.
Okay. So Amanda, I understand that estrogen dominance or low progesterone or whatever hormonal imbalance happens, that can that affect your mood? And how does it associate with the weight gain a lot of women complain of, especially who are on medication for menopause? Medicines are given to obviously stop your bleeding, and also people have to go through surgical menopause or medicinal menopause. So a lot of people have emotional turmoil happening because of the hormone imbalance and the weight gain. So how can you explain this?
So when it comes to estrogen, it's that same situation. So if someone has excess estrogen, that means it doesn't just stay isolated within that pelvic area, right? Estrogen acts on all the different systems of the body, including our brain. And so that specific part of our brain that controls our emotions can be impacted by too much estrogen. It can also be impacted by too little. So if, say, a woman has had a complete hysterectomy and is basically in menopause now, not producing any more hormones, not having enough estrogen can mean that you're not going to have enough of those serotonin receptors activated, and you actually make less of that feel-good hormone serotonin. So it can be like too much or too little. And then I think kind of the other big thing with weight gain is that, of course, it can impact your thyroid, which that's really dictating like how much energy are you burning, right? So the slower your thyroid gets, the less energy you're going to have to burn on a daily basis. And so that in and of itself can make it so that even if you don't change the way that you're eating, you can start putting on weight because you're not burning as much energy. But high estrogen or just having too much or not enough progesterone, that can also impact how we handle carbohydrates and like keep our blood sugar balanced and use insulin. And these are a lot of the reasons why estrogen can be so inflammatory, because when things are off, it's going to impact all those different areas of your body.
True that. And so Vimi, let's come to the treatment options. Okay, so what are the treatment options for someone with adenomyosis? Hysterectomy, as most of us are aware of, is a surgical procedure in case of severe cases, right? But is there any conservative surgical option for adenomyosis?
Yeah, there are treatment options. I would say endometriosis is easier to treat actually when it comes to adenomyosis because it involves the uterus. And as you said, definitive option is hysterectomy. So we have to resort to the medical therapy and conservative method first, and then it's a permanent solution. If someone wants, then we go for the hysterectomy. If someone has heavy bleeding and painful periods, we usually start with the hemostatic agents like tranexamic acid and some of the over-the-counter painkillers, and NSAIDs are involved. And it does help few percentage of patients, but if it doesn't help, then we have to go to the hormonal treatment. The hormonal treatment, all of us know the oral contraceptive pills and the progesterone-based therapy. The newer progesterone Dynogest is also available. Now here I would like to mention there is a device called as Mirena, which is a hormonal contraceptive as well. It is a intrauterine system or a IUD like copper T, which can be inserted in the uterus, and it releases levonorgestrel hormone. It is a progesterone hormone, same which the mechanism of action is same as the oral progesterone, but it acts locally. So as a conservative option, where patient is not looking for fertility or pregnancy, it acts as a contraceptive as well and gives a good symptom relief. Or if a woman is in the middle age group, wants to keep the uterus, it is one of the conservative options which can be offered. Now, in adenomyosis, the treatment depends on the age group. And we are seeing many of the adolescent girls having adenomyosis nowadays. So all the medical options can be offered, and some drugs work for some people, some do not work. So one size does not fit all. We have to tailor the medical therapy to their needs as well. Coming to the surgical options. Yes, I agree. The definitive option is removal of the uterus, that is hysterectomy, because the disease is in the uterus. As we always say that hysterectomy does not cure endometriosis, hysterectomy does cure adenomyosis. But we have to decide all these treatments depends on the patient's age, their requirement for the fertility, and their symptoms as well. Sometimes adenomyosis may be asymptomatic. They don't have any symptoms. We don't do anything. But if they have symptoms and they are looking for fertility, I'm coming to the surgical options, what we can offer. So in surgeries, there is a conservative surgery as well, which is called as adenomyomectomy. Myomectomy is removal of fibroid. Now, adenomyoma is also like a fibroid. It is a collection of the adenomyotic tissue in the uterus, and that can be removed to debulk the uterus. That is called as adenomyomectomy. It can be done laparoscopically, and the results are very good. People think that adenomyomectomy causes rupture in pregnancy. Pregnancy cannot go to term. They cannot carry the baby to term, but it is not the case. We are doing it regularly, and our results speak for themselves. That adenomyomectomy has good success rate in terms of spontaneous conception as well as in cases of recurrent IVF failures. And patients do continue pregnancy to term. So what are the indications when we do adenomyomectomy? The most common indication is recurrent miscarriage, recurrent IVF failures, or infertility. And in some cases where women is young, not trying for pregnancy, but the uterus is too big and her symptoms are so severe that cannot be controlled with medication. And in those cases, a debulking surgery by reducing the bulk of the uterus by adenomyomectomy can be done. Many people are not aware of it, Shilpa, actually, what adenomyomectomy is. So when we offer them, because they have been always offered hysterectomy as the final treatment, even if they have recurrent failures or recurrent miscarriages. So this is a very good option for patients who are looking for fertility and they have history of miscarriages and IVF failures. So adenomyomectomy is a conservative surgical option. Now, adenomyoma also has different types. So there also surgical option has to be decided according to the type of the adenomyosis. Sometimes it involves a complete uterus, that is called as diffuse adenomyosis. Sometimes it involves a portion of the uterus, that is called as adenomyoma. And sometimes it is an extension of endometriosis onto the surface of the uterus, that is called as focal adenomyosis of outer myometrium. Now, when focal adenomyosis of outer myometrium, or we call it foam as well, during the endometriosis excision, we remove that as well. But when adenomyoma is there or diffuse adenomyosis is there, as a first attempt, we don't touch the uterus until unless patient has this kind of history. we give it a chance. We give uterus a chance that they should conceive spontaneously if they're looking for fertility, or let them try after the endometriosis excision, but we don't do adenomyomectomy in all the cases. If after doing endometriosis excision and adenomyosis is still existing and she's not able to conceive, or there is a failure of attempt of conception with assisted reproductive technology, then we go for adenomyomectomy and as not a first option.
All right. All right. I think this was like quite helpful to people who have adenomyosis and who don't want to go for a hysterectomy right away. You know, you can probably go check with your doctor about the particular procedure Dr. Vimi has said. Amanda, coming back to hormones, is it possible that estrogen causes inflammation, and how does it affect your immune system?
Yeah, and I just want to say I've never heard of an adenomyomectomy. So I'm like, oh my gosh, I need to go research this. That's really, really cool. But when it comes to estrogen inflammation, a lot of it is how estrogen impacts our immune system. So it's a good thing. Estrogen can act in like a positive way. Like if we think of our cycle, like estrogen ramps up right before we ovulate, and that really turns on our immune system, activates it. And then we ovulate, pass an egg. And then during that luteal phase, our immune system calms down. That's why a lot of people can get sick that second half of their cycle. They might start to feel like they're getting sick before their period. And that has to do with your immune system being lower functioning. So the increase in estrogen, that high estrogen, that can turn our immune system on, which is good. But if it's too much, then your immune system can be overactive and it creates this inflammatory response within the body. And then of course, I think the other kind of piece where estrogen may not be directly causing inflammation, it's more indirect, where if you're a little bit more insulin resistant, the more insulin you're going to have to make to get sugar inside the cells, that can lead to more inflammation. If your digestion isn't great, if you're more constipated, that's going to lead to more inflammation, more high estrogen. And then of course, like thyroid function. So the more that we kind of get this big dose of estrogen, that's going to turn on that immune system and create this inflammatory response.
That's right. I mean, I understand that why after my total hysterectomy, my thyroid got back to normal. So,
that is so interesting.
Yeah, because I was hypothyroid and I used to take a pill for thyroid, and post my total hysterectomy, my thyroid levels just got back to normal, and I'm off the pill for the last couple of years since the time my hysterectomy was done. I was like wondering, how is this happening? But anyways, that might be one of the reasons. So how can I restore my hormonal imbalance? You can probably tell us a little about, what kind of food or what nutrition is required for us to probably, maintain the hormone balance.
I think like when I think of the clients that I work with that have endo, like one of the first things that we do is look at their digestion. How are they breaking down their food well? Are they bloated all the time? Are they constipated? If you are not having a bowel movement every day, you're going to recycle that estrogen because we get rid of it in our stool. So many women with endometriosis and adenomyosis do struggle with constipation. So just trying to relax at your meals, chew your food, things that I feel like we take for granted. And a lot of us are on the go, we're super busy, so you might not pay attention that much, but even just slowing down a little bit when you eat can help hugely with bloating. And then if you want to take it a step further, maybe you're already working on that, then I would say a very simple like apple cider vinegar before your meals or digestive bitters. These help to stimulate your digestive process. So if you're someone that does have high estrogen and a sluggish thyroid, that's going to slow down your digestive process because sluggish thyroid means less energy for everything, unfortunately, including digestion. And so if you can use like 1 to 2 teaspoons of apple cider vinegar or some digestive bitters, and that's just basically digestive bitters are just a combination of bitter herbs in a tincture. And then that bitterness from those herbs stimulates your digestive enzymes, your stomach acid, all these things that we need to break down our food. So my step one for people would be to start supporting your digestion if you're not. And then be mindful of if you're eating a lot of raw foods, that will be more challenging. That's a lot more work for your body. So we definitely want enough fiber. That's like the next thing I'll talk about. But when we eat too many raw veggies, I just see women struggle and they think they're being healthy, but it's like, it's just not super appropriate for your digestion right now. So I would say like go for more cooked foods. And then getting enough fiber in is huge, but this is a balance because some people will get more constipated if they eat too much. So I would say slowly work on this. So fibrous foods are going to be like any cooked vegetable, any sort of cooked greens is a great option. Fruit is great, and most people can digest that pretty well. Even if you're more sensitive, you could cook your fruit if you want. And then things like beans and lentils, those are great forms of soluble fiber, and that helps to bind to that estrogen and remove it from your digestive tract. So those are two really big ones. And I'm curious to know your thoughts on this, but have you guys ever done castor oil packs?
No, not really.
No. So I think they originated in India.
Yes, I've heard of it, but I never tried it.
So these are one of those things that like castor oil is very anti-inflammatory. And so you can get castor oil and put it on just like a cloth, like a flannel type, but like a thicker cloth, and put that over your lower abdomen area, where especially if you're experiencing bloating there, or you could put it over your liver, like the right side of your abdomen. But castor oil packs help to support your liver. So they can reduce inflammation, they can support your digestion, but castor oil can also stimulate your liver. And so for a woman that's dealing with estrogen dominance, if you have constipation, I cannot recommend them enough. And pain. So they've only been studied with fibroids. So they've been shown to improve reduce the growth of fibroids, but they haven't been looked at with endometriosis, but I still recommend them. And it's something that's nice, like you can do at home, it's relaxing. And it's a pretty easy thing to add into your routine.
Absolutely. I do think it will take time. And so how much time are you supposed to keep that pack?
I would do it for 30 minutes to start, because a lot of women with endo typically they have a liver that's been working really hard for a long time with the excess estrogen and the inflammation. So you can put it on for 30 minutes to start, see how you feel. If you get like headachy or tired, that's a sign that your body really needs it. You just need to go slow. So you don't want to like wear it for 2 hours straight because you feel like you should. You want to like gently introduce it. And eventually people can wear them overnight too. And then that way it's like part of your bedtime routine. You wear a castor oil pack to bed, you get that support. But it's one of those that has like a quicker, everyone wants like a quick fix. And it's hard to get that with hormones, but I would say castor oil packs are pretty close to that quick fix.
That was like super helpful. I mean, this is one tip probably which I'm going to try for sure. The next thing that I get off from here.
Let me know if you try it. You'll have to message me online.
I would DM you. So Amanda, two terrible things to happen with endometriosis, and of late, since the time we have been running this group, I've been listening to this complaint forever, is endobelly and insomnia, two big problems. So besides pain, these two things are something which actually make the lives of these women, women like me, terrible. So are there some ways in which you can manage these two things?
With the endobelly stuff is everything we just talked about. Digestion is going to be number one. Inflammation is big though. And so if you're someone that maybe you have all the symptoms of estrogen dominance, then I would really think about what are some ways that I can go like above and beyond and support my liver. So obviously the castor oil packs, the fiber is going to be huge. But even things like trying to include some milk thistle, it's like a very gentle herb that can support your liver. And then looking at like ginger, I usually say ginger tea. It's like you can really have ginger in any form, but that's a very naturally anti-inflammatory. Usually that endobelly is mostly honestly inflammation. It's often from that tissue that's grown outside and has nowhere to shed, right? So it just becomes inflamed. So trying to look at what are the ways I can reduce inflammation. And I've had a lot of success with removing gluten, which I know is not easy to do, but it's the only nutrition intervention that has been studied in depth enough where 80% of the women in one of these trials had a decrease in their symptoms from endometriosis. Like over a year they followed them. So I think it took 2 to 3 months for most people to see a change, which I'm like, that's hard because you make a food change and you think immediately, you're like, I'm going to feel better tomorrow. This is, like, and so when it doesn't work right away, it can be really challenging mentally, I think. But removing gluten is a huge one, or even trying to reduce it. I'm a pretty big, like, every food fits for the most part type of situation. But when you have this chronic health issue that is kind of taking you to this extreme, I think it's worth it to try to take gluten out of your diet and see, like, do you have a reduction in that bloating, that inflammation, and how does that help? And for insomnia, I find this shows up differently in each client that I've had with endo. Sometimes it is more anxiety related because anxiousness is very common. And I think that when it's more anxiety related, you want to pay attention to what are you doing all day, right? A lot of times when we think of sleep, we're like of your bedtime routine, like all that stuff is important, but how you live all day is going to impact how you sleep. So like, are you getting sunlight in your eyes during the day, or are you only looking at screens all day? That's going to impact your circadian rhythm, which is just our body's natural clock. So paying attention to, like, can you get outside in the morning time? That's really helpful. Getting outside can also help reduce those feelings of anxiousness. And if you are someone that feels more anxious when you're lying in bed trying to sleep, like worrying about why you can't sleep, or if you're going to sleep that night, I would say magnesium glycinate. That is a form of magnesium that is more relaxing. So that can be really helpful. That can also be helpful when you have lots of period pain, like trying to increase magnesium before you get your period and then taking more during it can be really kind of relaxing for those tissues. And then if you're someone that's kind of more like you just feel more stressed at nighttime, maybe your cortisol is higher, trying to use things like holy basil, valerian root. Those are my 2 favorite herbs, like to do teas of, that can be more relaxing. But thinking about, like, did I eat today? Because if you didn't eat all day, then like at nighttime, your cortisol is going to be high, so trying to balance your meals throughout the day, get outside. And then at nighttime, pick which part of your routine is going to be like calming. Maybe you do magnesium and the herbs, maybe you just do magnesium, but trying to get off screens. I think that's so underutilized and it can be hard, but it's a really great habit to get into.
True. I mean, magnesium did help me quite a bit. I mean, that's like on my daily chart since the time I have been on, since the time I developed insomnia. I think that has been like magnesium and sleep tea. These are 2 things which have like tremendously helped me, to sleep at night.
Magnesium has relaxant properties actually.
Yeah.
So it's a muscle relaxant as well, and that's why it helps in pain reduction also.
Correct.
Yeah.
Cramps and all also comes down because magnesium is a uterine relaxant also.
Correct.
And most people are deficient. Most of us aren't getting enough magnesium.
Correct.
True. Yeah. So, maybe let's get to the last question for you. If somebody does not get themselves treated for adenomyosis, what can happen?
See, as I said, there may be patients who are completely asymptomatic and they really don't need any treatment. Now, adenomyosis is being diagnosed now because of the high resolution ultrasounds and the training of the radiologist. Earlier, I tell you 2 to 3 decades before, the adenomyosis was a histopathological diagnosis only. They used to remove the uterus and they used to diagnose that the patient had adenomyosis. They never used to diagnose it before. So as such, it is a benign disease. Nothing happens in terms of if we talk about the progression and it's not like a cancer. But yes, if you have symptoms and we leave it untreated, you might develop anemia, pain, reduced quality of life, infertility, subfertility, because it's a progressive disease and over the years, it keeps on increasing. So definitely, if we keep it untreated, it is going to trouble you in the coming years. And if you have completed your childbearing, then you will present with menorrhagia and painful periods a little later. because when the disease has progressed and uterus is not able to take it, then definitely your symptoms will be more prominent. So these are the things which, basically the symptoms, the infertility and painful periods and heavy bleeding and subsequent anemia, lack of like low quality of life, all these symptoms will come up if we don't treat it. But yes, asymptomatic women, usually they may not need any treatment, and they may present in the perimenopausal phase or menopausal phase. When they're reaching the menopause, they may have abnormal uterine bleeding, and it might manifest at that time as well. And then at that point of time, hysterectomy is the cure.
Okay, all right. I think let's just take a couple of comments which are there. So Rachel says, I've had adenomyosis and had hysterectomy. It still feels like my moods are all over the place and just feel like I get out on anxiety medication all the time. The medication they put me on, I have side effects really bad with those, and I feel nothing is working. It's terrible, actually, Rachel. Honestly speaking, a lot of us are like that, who are going through issues. A little change in probably your diet and your lifestyle. I mean, I think that does make a difference. When you're anxious, that's something which you really have to, manage. Vidisha has a question. Is it possible to perform adenomyomectomy on diffuse adenomyosis?
Yes, Vidisha, it is possible. If the uterus size is big and diffuse adenomyosis is there, we usually debulk wherever the adenomyosis is most prominent, or either the anterior uterine wall or the posterior uterine wall. It is possible. We do that for diffuse adenomyosis as well when the uterine size is very big and there is an indication for such surgery.
Perfect. And Aarti says, wow, that's so informative about lack of sugar cause inflammation too, regarding high estrogen levels and the immune system. Is this why certain cravings and binge eating happens too, especially with endometriosis and being on limited diet?
I think so. I think the digestive one is why a lot of people are on a more restrictive diet, because they feel like they have food reactions. But a lot of women with endometriosis are often diagnosed with PCOS, like Vimya was talking about before, how it can be confusing understanding the difference between the two. So it's kind of one of those things where I feel like you have to rule out if the estrogen is causing the insulin issue versus, if it's actually PCOS that's present. But I think one of the biggest things you can do to kind of support yourself with that is to try to eat consistently. I know that can be really hard sometimes, but just like you were talking about the anxiety question, someone commented that they're dealing with anxiety, they're having terrible side effects from that medication. If your blood sugar has lots of drops, you're going to get an increase in our stress hormone cortisol, which is going to increase your alertness and can make you feel anxious. So if you can have protein and carbs, like some sort of animal protein mixed with some sort of like bean, lentil, fruit, something like that, consistently throughout the day, that's going to keep your blood sugar stable and can really help reduce insulin resistance and excess estrogen, but also that anxiety.
Makes sense. So Aarti says that I've done castor oil patches and they are amazing. So
yay! We have a testimony. Everyone get your castor oil.
And Rachel also says, will this help for PCOS too?
The castor oil? I think so, because a lot of women PCOS are dealing with estrogen dominance at some level because they typically have lower progesterone. And anytime, like if you have digestive issues, if you have bloating, they definitely don't hurt. One other thing that I feel like we'd have to do a whole other talk on is iron levels. So there's been a lot of research with iron accumulation in the pelvic area and how that can impact endometriosis. And castor oil is a natural iron chelator, so it can help remove excess iron from the body. So part of me also wonders, like, yes, it reduces inflammation, supports your liver, but is it also helping reduce some of that iron accumulation that can happen?
All right. And Madhuri says, does acupuncture help in hormone imbalance? It does, I've heard in some cases. Yes, you can. It's an alternate therapy which you can try. There are people who vouch for it. I think, Aarti, you can reply back to her. You have been into it, so probably I give this question to you. And Kate asks, what do you think of
pain? Acupuncture helps,
yes,
because many patients try that, and it does help, because sometimes even a post-excision, Complete pain may not go away. Excision is just a part of the treatment. So they may have some residual pelvic pain where acupuncture does help in a good number of patients.
Absolutely. It's one of the best things that people have tried as an alternate therapy. Yes. And Kate asks, what do you think about plant-based diet for hormone regulation, high fiber?
So I don't love plant-based. I think it depends on how you define a plant-based diet. I think everyone kind of has their own definition, but getting enough protein is really important. So I think if you're going to be primarily eating plants, like a lot of my clients that come to me that are completely plant-based and don't eat any animal foods, we work on adding like broths, like bone broth, stuff like that into their diet. That gives them some protein. Eggs are a great one. And if I can get them to do like dairy or seafood, then we'll add one of those in. But it's so hard to balance your blood sugar when you don't have any of those proteins in your diet. So while those diets do have a lot of fiber, they're missing that blood sugar kind of balancing component. And so if you're someone that feels like you do deal with more anxiety, maybe you do have a lot of that bloating, I would say trying to do a mix. Like I try to avoid any of those extremes because they tend to push your body out of balance and they force it to compensate, and it'll compensate for a while, but eventually you'll start to be more symptomatic and not feel as great.
Perfect. That sounds good. So it has been like an amazing session. Amanda, any parting words for our viewers? There will be questions which will be coming in. Please keep dropping in the questions. We will get back to you with all the answers, and we will put it in the comment section. But Amanda, I think we will get to our last thing. Any parting words that you want to tell us, give our viewers?
I think that's something like we're often so focused on food and supplements and our lifestyle, which I think is so important. But a lot of times I think we forget to have fun and do things that we enjoy. And I think if you're not working that fun, like things that make you passionate and happy into your healing protocol, if you want to call it that, or into that like healing journey, it's really hard to have that true balance. It's more than balancing your hormones. It's like you want to still live that full and happy life.
Perfect. So this has been like one of the best sessions we had. I mean, right from adenomyosis to hormone balancing, which are two terrible things to deal with. But I think we were able to help a couple of people, at least if not everyone, some people understand what these things are all about. Thank you so much, Amanda. Thanks, Remy, and thanks to all our audience who have been supporting us throughout. Thank you very much, and have a lovely, lovely week ahead. Thank you.
Thanks for having me. Nice to meet you guys.
Yeah, there is one question I would just like to answer.
Okay.
Somebody has asked, is subserosal fibroid adeno? Now, fibroids are different from adenomyosis. Fibroids are the benign tumors which arise from the muscle layer of the uterus, and adenomyosis is entirely a different pathology. Now, fibroids can be at different locations. If they are inside the uterine cavity, they are called as submucous. If they are inside the muscle layer, they are called as intramural. And if they are outside the uterine muscle layer, like on the serosa, that is called as subserosal fibroid. So it is absolutely a different entity from adenomyosis, but adenomyosis and fibroids can coexist.
Done. All right. Catch you all again after one Sunday, and we will be back again with another topic on endometriosis. Thank you and stay safe. Bye-bye.
Bye.